Okay, so today we are going to look at two hearing aids. The reason why we check them is to make sure that they are functioning properly, and if they're not functioning properly, we want to know why they are not, what the reason is. And we do this because we want to make sure that they're getting the maximum potential out of these hearing aids. Okay, so first I'm going to clean it because every time you use somebody else's hearing aid, you should disinfect it. So I do that with a sandy wipe. Okay. So this one is a behind the ear, and it's for the left ear. It's a Unitron Max ESP, and the serial number is 1436X2. For this one, it takes a battery called C675. It looks like this. It's one of the bigger ones, and you put it in there. This one is in the ear, and it's also a Unitron. It's an Unitron HS. The serial number is X1323J0M3. It takes a size 13 battery, and it's for the left ear. So I'm going to be doing a visual check as my first step. I'm going to look and make sure there are no problems. I can see on this behind the ear there is a crack in the vent part, so that needs to be fixed or replaced. The tubing it's okay. It's not yellow or hard. The battery door works, the volume and the memory button all work. So besides for this crack, it looks pretty good. And for the in the ear, it looks good. The memory and the volume button is right here. It's working. Battery door also working. And here we have the microphone, and microphones are over here. They're not occluded. And there we have the vent and the soundboard, which all look clean and ready to go. Okay, now I will show you how we properly clean a hearing aid. So we're going to use the BTE first. We use a little song, brush, brush, scoop, scoop, pick, pick, and blow, blow. So I'm going to brush all the excess debris and wax from the hearing aid. And then I'm going to take this little scooper thing and put it into the opening, the little hole, to remove any earwax that might be occluding the hearing aid. Okay, and then I'm going to put this little stick part into the vent to clear it, to make sure there's no wax. I've got a little bit of wax here. And you push that in just to make sure nothing is there. Then I'm going to separate the hearing aid, to use the blower to make sure that there isn't any condensation inside. I'm going to just blow, and you want to always work over a table, and don't do it towards your face because that would not be good. Now for the in the ear, I'm going to brush it also. Then again, use the scooper and clean the vent with the stick part. And for this, we don't blow because it doesn't have those tubing. Okay, so first I'm going to check the batteries to make sure that they're working and they're good. So it's on the green part, which means that they're good. I'm good. I just want to say, before I said that the battery was a size 13, I was mistaken. It's a 312. I'm going to check that, and it's also good. So these are working. So I'm going to open the BTE battery door, and I'm going to make sure that I'm inserting it correctly because we don't want to break it. Okay, so I'm putting the battery into the battery slot and closing the door. Okay, I hear some feedback, so I know it's on. I'm putting the bell tip of the stethoscope on the soundboard to make sure that I hear the sound. Oh, it's really loud. Okay, I'm lowering the volume. It's really loud. Okay, so now what I'll do is I'm going to say the Ling 6 sounds, which are oo, ah, ee, sh, and Ooh, ah, ee, sh, Okay, this is good, very loud. I'm going to check for feedback by just closing it with my ears. There's a lot of feedback going on. So now I'll do the same with the in the ear. Opening the battery door. Putting in the battery. I hear the dinging to indicate that it's on. Okay, and again I'm going to do the Ling 6 sounds, oo, ah, ee, sh, and and I hear them perfectly fine. I'm going to play with the memory button, see that it's working, which also is the volume. Okay. For this solution part for the hearing aids, so the BTE, I'm going to refer back to the audiologist to make sure that the hearing aid either gets replaced or fixed because of the vent part being cracked and broken off. And for the in the ear, I'm going to also refer for an audiologist referral because of the feedback. Okay, so we're going to do the otoscope observation first, and I'm going to instruct the client that I'm going to be using this instrument to just look into her ear. So Diana, I'm going to be looking into your ear using this, and I'm just to make sure that everything is nice and clear, and I'm going to ask you to put your head in this position, which is called the puppy dog position. Okay? And we do this to make sure that the ear canal is clear, no cerumen, no foreign objects. I want to see the tympanic membrane and look to see if there's any infection in the middle ear, any fluid, any liquid, any perforations in the tympanic membrane. So I'm going to first insert a tip onto the otoscope. I'm wearing gloves, and I'm going to start with the right ear first. So right ear, right hand, and I'm going to hold it like this, and I'm going to brace against her cheek and slowly watch my way into the ear canal. Oh, but first, you want to make sure that you turn it on like this. You see the light? It's bright, so I know that it's good. Brace against the cheek and look in. Okay. So the ear canal is clear. Minimal earwax. I see the tympanic membrane, the cone of light, the umba, pars flaccida, and a bit of the manubrium. So I'm going to go on to the left side, and I'm going to switch hands, put it in the left hand, and I'm going again to brace with my 3 fingers and watch my way as I guide in. Okay, so the ear canal is also clear, just minimal cerumen, and I see the tympanic membrane, the cone of light, the pars flaccida, the umba. So that was good. This is your... So now I'm going to do the hearing screening portion. We do a hearing screening to make sure that the client can hear at the level of 25 dB for adults. Just to, if they can't hear out that sound at that intensity at the frequencies, then we're going to refer for complete audiological evaluation. So this is just a screening, not a full test. I can't determine whether the person has a hearing loss or not, but it's just a screening measure. So I'm going to perform a hearing screening on Diana. I turn on the machine, and can you see? I don't know, how do I flip it? Okay, so I'm going to press the AUD for auditory, and I'm going to do the right ear first, because usually you either start with the right ear or the better ear. In this case, we're going to start with the right ear. We're going to put it at 25 dB. That's our intensity level for the hearing screening. And we're going to test at 1,000 frequency, 1,000 hertz, 2,000 hertz, and 4,000 hertz. So right now it's set at right ear, 25 dB at 1,000 hertz. Okay? I'm going to place my headphones onto Diana while instructing her. So Diana, we're going to perform a hearing screening. I'm going to place these headphones over your ears, and I want every time you hear a sound, even if it's very faint or low, I want you to raise your hand, okay? So the red is for the right ear, and the blue is for the left ear. Is that nice and comfortable?
Yep.
Yes, okay. And I'm also going to face her away from my machine, because I do not want her watching me press the button, because then she'll know when to raise her hand. Okay. So you can take a look over here. I'm going to be presenting the tone using this button. Sorry, having trouble with this camera. Okay. Okay, here I switched my camera so that you have a nice vision of the audiometer. So we keep it at 25 and we go to 2,000. And we're also presenting it twice. And as I'm presenting it, I am watching her, but I'm not picking up my head because I don't want her to notice that I am expecting a tone. So now it's at 4,000 at 25, and I'm going to present it not in intervals. I'm going to do it at random times so that I know she's not expecting it. Then I'll switch over to the left ear. Do it at 25 at 1,000. Okay, and that'll conclude our audiometer hearing screening. Now I'm going to be walking over to my client. Dana, can you hold this? And I will be removing the headphones. Thank you, Diana. You passed the hearing screening. If someone did not pass, I would make a referral for an audiological evaluation with an audiologist.